Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. February is American Heart Month, and joining us today on Speaking of Health to talk more about the heart and how to stay heart healthy is Dr. Durga Komaragiri, also known as Dr. Giri at Fairmount Medical Center, Mayo Health System. He cares for patients as an internal medicine specialist. Dr. Giri, thanks for joining us today on Speaking of Health.
You're welcome, Jason. Thanks for having me.
Well, with Valentine's Day in February, we often think of the heart as a symbol of love, but it's not just love that the heart represents, right?
Yes, Jason. The heart is a muscular organ the size of a fist, or a person's fist, whose primary function is basically to pump blood through the body's blood vessels. On an average, it beats about 72 beats a minute in a person, and in an average lifetime, about 2.5 billion times.
So the heart does a lot of work in a person's body throughout their lifetime. You hear so much today about heart disease. What exactly is heart disease?
Now, heart disease is a wide range of diseases involving the heart. The first thing would be a blood vessel disease, namely cardiovascular or coronary artery disease. It could be a problem with the heart rhythm or a cardiac arrhythmia. It could be something to do with the structure of the heart, of congenital heart defect, or it could be heart infections.
So heart disease is a range of different things. Let's start with the blood vessels. What is cardiovascular or coronary artery disease, and what are some of the symptoms of that?
Now, coronary artery disease or cardiovascular heart disease is basically caused by narrowing of the blood vessels or a blockage of the blood vessels, which could be caused by an unhealthy diet, inadequate exercise or lack of exercise, being overweight or obese, and smoking. Now, the symptoms of a person presenting with coronary artery disease would be chest pain, shortness of breath. Some of the associated symptoms would be sweating, nausea. It can also lead to lightheadedness, and sometimes you can have pain going down the arms. Now, these conditions may not appear in the very early stages. Usually, a patient has to have very severe coronary artery disease before manifesting the symptoms.
So, Dr. Giri, what about abnormal heartbeats? What are those?
Now, abnormal heartbeats could be because the heart is beating either too fast, too slow, or it could be beating irregularly. As we had alluded to earlier, a normal heartbeat on an average beats about 72 times a minute. Now, the causes of this could be, again, multiple. Heart defects, the coronary artery disease, it could be because of abnormal tissue in the heart from previous scar tissue or a heart attack, high blood pressure as an independent cause of this, cholesterol, diabetes, smoking. It could also be caused by intake of caffeine as well as alcohol, to a greater extent, underlying stress.
And what are some of the symptoms that you see with abnormal heartbeats?
Some of the commoner symptoms that are noticed are fluttering in the chest, a rapid or a racing heartbeat, a slow heartbeat wherein one can feel faint. It can be associated with chest pain or even shortness of breath.
And what about heart defects? What exactly are heart defects?
Now, these are congenital heart defects which usually can develop in the womb. So usually can manifest very early in infancy. Sometimes you can see it during childhood or even adulthood. Now, serious congenital heart defects are the ones which usually present themselves in infancy. Now, they can manifest as pale gray or blue skin in the infant soon after birth, swelling either in the legs, in the abdomen, or around the eyes or the face. Also can manifest as difficulty with feeding and shortness of breath. Now, the less serious effects with congenital heart disease usually present during childhood or adults, and these are usually not life-threatening.
So the serious ones, you'll see those at a very young age. Those are infants that have the very serious heart defects, right?
Yes.
So some of the symptoms with folks that have the less serious heart defects, what are those?
Usually they are also similar, associated with being easily tired, being short of breath. You can have signs or symptoms of the congenital heart defect, wherein there could be swelling of the legs or of the abdomen, signs of heart failure.
And we talked about heart infections. How exactly does an infection in the heart occur? How does that happen?
An infection could be, again, because of multiple causes, but the main effect is something which affects the heart muscle. So it could be because of bacteria, could be because of viruses, it could be chemicals or other diseases.
And symptoms of heart infections, what are those? Are they different than symptoms of some of the other heart diseases?
Now, the symptoms of any infection usually would be a manifestation of the infection itself, which could be a fever. Because the heart as a pump and because of its rhythm problems, you can normally see an irregularity in the heartbeat. You can see problems with swelling of the feet. You can see shortness of breath, chest pain sometimes. You can see a dry cough or even the appearance of a rash.
And when you talk about swelling in the feet or in the legs, why does that happen? If you're talking about the heart, why are you getting swelling in your extremities?
Now, this is because of a volume overload. The heart is unable to pump effectively. And obviously, this causes fluid to accumulate in the legs or in what we call as dependent areas. That's because the heart itself cannot function effectively to circulate the blood going through the extremities.
So let's talk about risk factors, Dr. Geary. What are some of the risk factors associated with heart disease?
Now, the most commonest risk factors associated with heart disease or cardiovascular disease would be your age. The older you get, the higher the risk. Your sex. Men generally are at a greater risk compared to women, and the symptoms sometimes or the presentation can be different. A strong family history. Somebody having heart disease or narrowing of the arteries are more prone to develop coronary artery disease or a blockage. Smoking. Bad dietary habits wherein a high fat or a high salt intake can lead to this. Independent risk factors include high blood pressure, cholesterol, or even diabetes. Being overweight or obese, high stress environments are independent risk factors again.
And what can heart disease lead to?
Now, once a patient has heart disease, or the symptoms of this would obviously be manifest by heart attacks, wherein they are caused by either a narrowing or a blood clot blocking the blood vessel. It can lead to heart failure, wherein the heart is unable to pump enough blood, thereby causing swelling of the legs or of the abdomen or of the face. It can lead to a stroke. It can lead to an aneurysm, which is a bulge in the wall of the artery because of weakness, or sudden cardiac arrest, wherein there is an unexpected or a sudden loss of breathing, heart function, as well as consciousness. Now, if medical treatment is not given to immediately, this can be fatal.
All right, Dr. Geary, well, those are all very serious things that can happen to you. What are some of the typical tests that you do to find heart disease?
Some of the basic tests that you would want to do if you are trying to evaluate for heart disease is to do a thorough and complete physical examination. Now, this would include blood tests. This would include chest x-rays to make sure that there is no other associated lung or structural heart problem. This would include an EKG, which is the electrical impulses from the heart, or it could be an echocardiogram, which is the ultrasound of the heart.
So how does a patient, and how do you as their physician, how do you treat heart disease? I find out I have heart disease. How do you treat it?
As we had alluded to earlier, because heart disease is a varied presentation with coronary vascular disease or coronary artery disease, or it could be because of a rhythm problem, it could be congenital heart disease or infections. You treat these appropriately based on the presentation. If it is a coronary artery disease, you evaluate the patient as far as their diet is concerned, exercise. You can use medications. You can ask them to change their lifestyle, quit smoking, eat healthier. And if obvious narrowing of the arteries are found, further testing using angiographic studies or even surgery would be recommended.
How about with heart arrhythmias, irregular heartbeats? How do you treat that?
Now, this usually would be treated by vagal maneuvers, medications, electrical shock applied externally to the heart called cardioversion. This could be by a pacemaker implantation or what is called a defibrillator for serious or potentially malignant heart arrhythmias, or surgery as a last resort.
So, Dr. Geary, how about heart defects? How do you treat heart defects? Can they be treated?
They can be treated. If diagnosed in infancy, immediate surgical attention is what is required in order to literally save the infant's life. Now, if these are minor, found either during childhood or adulthood, sometimes people do tend to outgrow this, so they may not require any treatment. Otherwise, medication, cardiac catheterization to find out if there are other abnormalities, open heart surgery, and finally, if there is enough damage to the heart but salvageable, can even consider heart transplant.
And lastly, heart infections. We talked about those too. How do you treat heart infections?
Basically, as we would treat any other infections, primarily the usage of antibiotics would be essential. There are cardiac medications, namely ACE inhibitors, beta blockers, and if need be, surgery, if we do find that there is a bacterial clot or a vegetation affecting one of the valves of the heart.
All right, Dr. Geary, what are your words of advice, your final words of advice for folks to improve their heart health?
In order to improve heart health, the ideal thing would be adequate exercise, follow a good diet, quit smoking, lifestyle changes wherein you are eating at least 1 to 2 portions of fish in a week, healthy food in the form of vegetables, fruits, and whole grain, low saturated fat, low salt diets, manage stress, practice good hygiene overall, get yearly flu shots, see your doctor regularly.
All right, very good. Great words of wisdom. That's all the time we have, unfortunately, but we want to thank Dr. Geary for joining us today on Speaking of Health. It was a pleasure. Thank you.
Thank you.
And just a reminder for folks, Dr. Geary will be giving a public presentation on this topic on Thursday, February 24th at 7 p.m. in the main classroom at Fairmont Medical Center, and everyone is invited to attend. Have a great day, everyone, and be healthy.